gosh, makes a ton of sense. And now you are making a difference with UBERDOC. You've invented something awesome that doesn't necessarily address all the problems of healthcare, but does wisely choose which problems it's going to deal with and allows patients and physicians to sidestep parts of the system if they both agree. And I think that's great. So what is UBERDOC and what made you start it?
So UBERDOC is a platform. It's a network of direct pay specialists where a patient can find a doctor who is nearby and available and make an appointment, go and see them in person or via telemedicine, and pay a transparent price through a health savings account or credit card. So it doesn't require a phone call, a referral. It's again to try to bring care local. Like way back when I was writing, I still write angry letters, but when I started writing angry letters, I was reading an article about a woman in New York City who twists her ankle. Okay, she goes to the walk-in or the ER wraps her up and then gives her a referral. She goes to her primary dutifully, who then promptly refers her to an orthopedic in Stamford, Connecticut. Now, she doesn't have transportation. She has she's on crutches. Right. She lives in Manhattan. She Googles orthopedic surgeons near me and finds about 15 of them. She picks up the phone, makes an appointment, goes in, pays cash, and she said, "Why can't it be that way?" And that was my aha moment. I'm like, absolutely. Why can't it be that way, right? Why can't it? What makes it not that way? And then I looked at it and I said, there's nothing that makes it not. As long as there's a doctor who's willing to put a seat aside and take a cash pay patient without a phone call, through an appointment scheduler, and as long as there's a patient who's willing to pay the transparent price for the visit, it can be that way. And so that's where UBERDOC was born.
That makes sense. Are there any rules for doctors that are enforced by their employer? So that the health system they work for example, in some technology companies, they try to have these that are considered generally unenforceable contract terms around moonlighting, working on something during your spare time, or intellectual property that you create while employed at that company is all under the company that you work for. Do doctors have to deal with that if they want to also be on UBERDOC? Or is it
UBERDOC is just an appointment maker, right? So any doctor anywhere can be. Now, naturally, the independent doctors can join easily. They're like, oh, sure. It doesn't cost anything for doctors to join. They can join in minutes, and they can post their appointment slot. So there you go. And it's easy. You say, okay, I see my patients every Tuesday morning at 9 a.m. So at 8:45, there's a slot. It's like a ticket, right? It's like I perform 8 shows a week, and I'm going to put a house seat aside, for my Wednesday matinee, whatever. That's how it works. So now doctors who are employed by big groups or institutions, they have to kind of like push it through they have to push it through the bureaucracy, right? They say, okay, great, I'm going to post an appointment slot, but then who gets the payment? It's easy when you own your practice because it's your bank account. But when it is when you're owned by someone else, that's where contracts come in, where like you can't practice medicine. If you're going to get paid to see a patient, the institution has to get the payment. And most doctors are perfectly fine with that. It's just that when they go to their office manager and say, do you have the bank account number to put in? The office manager goes, oh my God, we got to go up the channel. We talk to the director, and then the director goes to this, and the director, then all of a sudden it goes all the way up to like the CFO. Now, no one really has an objection to UBERDOC. I started with all the boardrooms in Boston and got, very good responses and standing ovations, right? Because who wouldn't take a patient for cash? I mean, come on. It's like, why would you turn business away, right? But their bureaucracy and the way institutions work, it's like a 10-year sales cycle. I mean, it's terrible. It's right there, and then of course COVID hit. So it's like, we can't do anything until after COVID, right? We're dealing with COVID now. So COVID became the great excuse. So now, of course, access is a huge issue. Those receptionists are not there answering phones. And no one's going to work in a cubicle with no ventilation for $10 an hour anymore. You can outsource it to some degree, but patients really want the convenience. They just want to make an appointment. They don't want to put aside a whole day waiting for someone to call them back. It just doesn't make sense. So we're approaching a lot of this institutions and say, let's just make your appointments for you. Just put a few seats for a block. So again, so we're system agnostic. We can work with anybody. My goal is a seat in every waiting room, whether it's a big institution or whether it's a rural practice.
And how are the health systems responding to you as their scheduling system?
Again, the people were always really excited about the model. My biggest fans are CFOs, because the chief financial officers see the bottom line, and control the patient access. But then as it filters through the layers, again, it's one of those things where it's just easier for us to just go right to the doctors, and I kind of feel like it has to come from the doctors. We have some doctors at big systems; they're just on UBERDOC on their own, because if they wait for the system to sign off on it, took 6 months with partners, our biggest, in their legal team, just try to tear it apart, and then they realized they really couldn't tear it apart. It's just a health savings account or a credit card.